So for the next type of hematuria, that's based on the classifications of hematuria, how different types of hematuria actually present. The one we'll be looking at is what is known as the persistent hematuria. Persistent hematuria. So basically, everybody already knows what hematuria is. Hema meaning blood, urea meaning urine. Okay, so that means what? There's blood in urine, and this type is persistent. So what are the characteristics? What makes it special, or what makes it different from the other types of what hematurias that we have? So let's quickly discuss this persistent hematuria, going from the definition to the causes, and going to the evaluations and management. Evaluations is basically ways we can use to investigate. Okay, evaluation is another way. It's just like a modern way of talking about all those laboratory investigations, imaging investigations, and all that. So this persistent hematuria actually refers to what? Note this: continuous presence of blood in urine over a prolonged time. Okay, so there's a continuous what? Presence of blood in urine. Okay, and this is typically what? For more than 3 to 6 months. All right, so a patient actually comes to the clinic and they are telling you that they have been seeing blood in urine over a long time. To me, I would say that this persistent hematuria is still the same thing as what chronic hematuria. Okay, so now what is the definition of this condition? We said that definition of characteristics. Okay, there will be blood in urine, that's hematuria, and it will persist despite initial evaluation and treatment. So this type of hematuria has been evaluated and has been treated along the line, okay, but is not resolving. Okay, then it will also persist despite what? Resolution of underlying cause. So it could be that it was urinary tract infection that caused it, it was kidney stones that caused it. All right, so you have treated the kidney stones, you have treated the urinary tract infection, but it is still persisting. Okay, and despite what? Absence of systemic symptoms. So there will be no associated systemic symptoms like fever and hypertension, okay? But you just be having a persistent what? Presence of blood in urine, okay? So what could be the causes? It could be that you didn't discover all the underlying disease conditions. Do you understand? So it could be that there are some other disease conditions that are still left, right? Conditions like kidney disease, all right? Different kidney disease like what? Glomerulonephritis and interstitial what? Nephritis, okay? It could be that there was a bladder or kidney cancer. It could be that the person has prostate issues like prostatitis and benign prostate hypertrophy. Okay, it could be that there's presence of what? Chronic urinary tract infections. It could be that there was a kidney damage or scarring of the kidney. It could be that there's vasculitis. What is vasculitis? That's inflammation of what? Blood vessels. It could be that the person has genetic disorders, like for example, we have the Alport syndrome. Okay, so the whole thing is, yeah, the person was having hematuria over a long period of time, but if there was an underlying cause, you guys did not discover all the underlying cause. So you treated some underlying cause, leaving some underlying cause, so the hematuria still continued. That's just my way of explaining it. Evaluation now. How can you be able to dictate this condition? You repeat urinalysis to confirm persistent hematuria. Okay. They could also do imaging studies like ultrascan, CT scan, MRI scan. Okay, just to visualize the urinary tract. All right. You can do a cystoscopy to examine the bladder and urethra. Right. You could do a kidney biopsy to access kidney tissue. You could do some blood tests just to evaluate kidney function and rule out other causes, right? So what is the management? Please, you always check for all the underlying possible causes, right? So that I don't treat one and leave one. Okay. You should monitor kidney function and urine output. You should refer the patient to a nephrologist or a urologist for specialized care. So, in as much as all of us are doctors, people who specialize still have in-depth knowledge about what a section of medicine more than others. Do you understand? Then you should consider what immunosuppressive therapy for kidney disease, right? Then regular follow up to access what disease progression and what help you to adjust treatment. Okay, so you know that what you are doing this type of treatment, the disease condition is still there, then you need to switch up and all the stuff, right? So this is persistent hematuria, definition, causes, evaluations, and treatment.